Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. The winter storms that swept through much of the country in mid-February caused a significant disruption in the COVID-19 vaccine efforts nationwide. Among one of the hardest hit states was Texas, where millions of people were left without electricity and even safe water supplies. And the storm definitely impacted providers on several fronts. In fact, two hospitals that are part of the Houston Methodist system had no city water for a couple of days. They had the reserves, but no city water coming in. And that's on top of trying to get vaccines into patients' arms. I'm joined today by Dr. Marc. He's CEO of Houston Methodist, to talk about the challenges of confronting these two crises at the same time. Marc, thanks so much for being with us.
Thank you, Matthew. It's good to be here.
So we're recording this in late February. Tell us sort of the state of play. Obviously, the storm we were talking before we came on, the ice and the snow was, by Midwest standards, not huge, but it was really that lack of electricity and power. What are things like right now in Houston?
Well, thankfully, it's about a week post the storm now, and thankfully things have returned largely to normal. Certainly, from a overall societal and community basis, things have returned essentially to normal. Lots of our staff dealing with broken pipes and the damage thereafter. A number who still don't have water because of their own broken pipes now, not because of municipal supply not coming in, but because getting a plumber is a 1 or 2 or 3 week affair right now, given the issues we've had across the city.
And so as you look across what happened for Houston Methodist, obviously you're used to hurricanes, natural disasters coming in. So managing during crisis is not necessarily unique for you, but you're managing during this crisis, during the storms, while you're trying to do a rollout of the COVID-19 vaccine. So what kind of leadership issues did you start going through at the very beginning of the ice storm coming in, people without power, as you say, people without water?
Yeah, I wish we weren't so experienced with disasters around here, but we've been through Tropical Storm Allison 20 years ago, which flooded our main campus and all of the Texas Medical Center. We've been through Katrina and the evacuations from New Orleans coming here. 2 months later, Rita, when the whole city evacuated, and actually there were more deaths from evacuation because the hurricane never really truly hit. To Ike in 2008, to 3 years ago, Harvey, where there was massive flooding around the community, not in the hospitals, right, and so many people injured. And then, of course, the last year of COVID that we've all collectively gone through. A disaster on top of a disaster is not something that we like to be prepared for, but we have to be prepared for. And so, going back as almost a year ago, probably in the April timeframe, as we're dealing with COVID, we started thinking about what does the summer look like, right? We're experienced with hurricanes. In fact, we had a hurricane this summer that was barreling at us, but fortunately turned. And so we were getting very prepared for that. So we had done a lot of discussion and look at, how do you do both? Because it's very different during COVID. And that was one of the challenges this time. I think the first and foremost challenge, honestly, is fatigue, right? We're all just tired. Everybody's a little bit on edge. Everybody's a little cranky. And there was very much of, oh my goodness, one more thing we have to go through, feeling. And motivating oneself, motivating a team is a lot harder in that scenario than, let's say, a normal year where, okay, everybody's had a relaxing summer. And then, on Monday, you figure out that a hurricane's barreling down at you 5-6 days out, and everybody rallies together and does that. So that was a challenge, no question. Another thing that COVID put as a challenge is, the normal sort of ride out recovery that we would just call on a without hesitation. We looked at that in two things. One is we knew everybody's tired. So the last thing we want to do is over sort of put the ride out and recovery in place with a bunch of exhausted people. But the other issue, of course, being that, you can't put together a conference room with rows of cots where a bunch of staff stay. And so the logistics of housing staff for ride and recovery are difficult. So we went with a modification. It ended up working reasonably well. Everything always has its challenges, but that worked fairly well. The hard thing that evolved over the next couple of days is, this was a projected weather event. We knew it was going to freeze. We knew that Texas is, never prepared for a freeze. We have essentially no snowplow capability, no salt, no sand, so we knew ingress and egress would be an issue, but probably a time limited issue. We knew there'd be some power outages, but nobody really expected days of grid failure, right? That's not what was expected. And so what made this time particularly challenging was not the hospitals from an electrical standpoint. Either they were on generator, in most cases they were protected on the grid. It was the fact that the vast majority of people who worked at our hospitals, in any capacity, were home without electricity. And then what ended up sort of spiraling after that was without water. And so many of our communities were without water. And this time we had 2 hospitals entirely without water from the city supply, one in Baytown, Texas, which is a eastern suburb of Houston, and the other in the west side of Houston. So really on both ends of our market, both of whom were out of water for either 48 or 72 hours.
And if I understand in that scenario, staff were actually running outside to collect rainwater, right, to bring it back in and this wasn't obviously for immediate patient care, but it was more for laundry and other things, right?
Yeah, obviously we staged drinking water. We were fine from that for the system as a whole. As always with a disaster, then worrying about supply chain and continue to bring that in. And of course in the winter, much less of an issue of running our chillers, because that's always an issue in summer when you deal with a hurricane is, you can't air condition. And trust me, in Houston, it gets really bad if you can't air conditioning in a hospital. But not being able to heat is also obviously an issue, and there's still some water needed for that. But the biggest issue, of course, you need water for, typical running water throughout a hospital. Thankfully, that doesn't always need to be potable. I mean, you'll have to make some adjustments if it's not. And so there are ways around that. So we trucked water in. All of our hospitals have a large holding tank. So you're able to truck and fill that in or fill that up. You still go on water conservation, but, it's not so bad as that you can't, flush a single toilet, for instance. But it took us a while to be able to do that at one of our hospitals. The day after a lot of this snow, we had some rain in the middle of the afternoon that then was worried about icing back up that night, but they were literally got creative. They took those laundry carts, that are on wheels that, kind of diagonal in the front,
right,
that you haul trash or laundry or other things around the hospital. And they literally took a series of those and rigged up a little pump that would take rainwater and then pump it into those. And they distributed those around nursing units so they could be used for flushing. So people's ingenuity, great. I will say during a disaster like this, we always talk about the nurses and the doctors and the respiratory therapists and, the MAs and others front line, particularly in COVID, you think of those groups. We often don't talk about the people behind the scenes that make it work. In a disaster like this, all of those people are heroes for sure, but the true heroes are these, folks working 24/7, figuring out how to keep the systems running, getting ingenious and finding out ways to get water, like what I just described there. I mean, that's literally one of our physical plant people who knows, who has those skills to say, okay, well, if you take this little pump here, we can create this circuit, and we can get water in. And that hospital was without water for 72 hours. And so they did have a period where they didn't have the trucks coming in. They used that. The other hospital was 48 hours. And then every single hospital but one ended up on a boil notice. So the water pressure across all of Houston went so low around Houston, and it was trickling even at the main hospital at one point, certainly at our homes, so that they ended up putting us on a boil notice really till Sunday. And so none of our hospitals had potable water coming out of the faucet. So there was still a lot of adjustments. Thankfully, we can recover from that quickly. The other thing that happened in all of our buildings, as you would expect, when it gets to the low teens in Houston, I can't remember that happening. It's been over 30 years. You have pipes breaking. And so we were dealing with, rainstorms basically on multiple parts of different buildings across the system. And again, those facilities people, on the spot, dealing with those issues, cleaning up quickly, getting things fixed very quickly. So this week is kind of crazy because now we are, doing, way more volume than normal. And all of this on a setting of still having about 425 patients with COVID across our system. So we're at about, our peak was 750 this time. Our peak in the summer was 750. So, we're down maybe 40% from peak, but we're still, far higher than where we've nadir'd a couple times during the year. So a lot of stressors on the system right now for sure.
Were you seeing, too, an increase in patients, maybe home dialysis or things that they would have been doing at home without electricity, and now they're coming to you for?
Yeah, this is the third major disaster where we have dealt with the dialysis issue. Some progress has been made. The different national dialysis companies have medical records that during an emergency will talk to each other, so they're able to dialyze each other's patients, more readily and things like that. But the bottom line, at least in Houston, Texas, and the rest of Texas, is most of those dialysis centers are small. They're in strip centers. They're standalone. They don't have generators. This time we had access to water issues for the whole city, so they just shut down. And they shut down without ride-out and recovery teams, without staff in place, without ability to get equipment to any of the hospitals or anywhere else. So what the hospitals all end up doing is having literally 20% of our volume in the emergency rooms began to be patients who were overdue for dialysis. Some of them, rather routinely, but nonetheless going to experience fluid overload or, electrolyte issues, hyperkalemia, et cetera. And some who had critical values of potassium, who are very volume overloaded, who are tipping over into heart failure status and other things, or volume overload status. And so it is a massive problem, and one that, I'm going to be quite honest, we're very frustrated by, because that industry has not addressed the issues that it should have in past disasters. We've taken a couple passes at that to try to address that, and this time very aggressively working with the Texas Hospital Association and others. We're going to get some answers to those solutions, because what happens is the hospitals have to do that. I'm going to give you an example. We took our massive conference room at the main hospital, turned it into a triage center so we could overflow those patients that would be coming to the ER, and then actually took an ICU that has been closed because we built a new building. The only time it's been open since 3 years ago when we opened up the new building, or 2 years ago when we opened the new building, was actually as a COVID unit at one point this summer when we needed more ICU space. And we rapidly opened that up as an ancillary, 24/7 dialysis center and hospital. We did this across our system, and every hospital I talked to around Houston had to do this. So what that ends up doing is first off, you get some people very ill, people who need a lot of care, where we're serving to do that, which of course is our obligation and duty. And, of course we're going to take care of those patients, but that could be avoided if we had the right disaster preparedness for many of these standalone sites. So, that's generators, that's, water storage, because dialysis uses a lot of water. It's probably creating at least some hardened sites they can all share. It's ride-out and recovery teams, which none of those places are doing. And so we've got to push that industry to do that, because what ends up happening, you overflow the emergency rooms, you've got all these sick people, and of course it's the time when we're getting, a large volume of patients. In this case, of course, hypothermia, carbon monoxide, slips and falls, people without power for days. So all the usual issues, not just dialysis, but people on, ventricular assist devices or other devices, et cetera. And it really exacerbates and sort of dominoes through the system, because then the ambulances get backed up. You can't find it, et cetera, et cetera. So we've got to work on that, and we will work on that very actively. We hope we can partner with that industry, but we're going to obviously need to push them.
Yeah, sounds like a pretty dramatic situation that you need some legislative and regulatory help on, for sure. I want to pivot, Marc, to COVID itself, talk about sort of where you are. Excuse me. My understanding, too, is that Harris County, one of their facilities, was about to lose some of the doses that they had, vaccines that they had. In Houston Methodist, you had to kind of come in and emergency vaccinate a bunch of people, right? What happened there?
No, that's exactly right. To put that in perspective, so the storm hit Sunday night. So Monday morning in Houston was ice and snow on the roads, totally unprepared to do that. So not much good ingress and egress. It could be done, but, most of the care was done by having people, in-house, right, modified ride and recovery teams and those sorts of things. Really, the power issues were becoming had started, but really got bad later that day into the next few days. So we get a call that morning because the county had lost a generator, had lost power, and then a generator failed. And they had doses of Moderna that needed to be used. They called us up, said, hey, this needs to be used within 3 hours. That turned out to be inaccurate, but that's what they thought. They got better guidance later from Moderna. So they said, can you help? And so we looked at it and said, we really can't put out a call to our usual schedule or accelerate schedule or invite, because we don't want people getting on the roads. It's not safe right now. So we started thinking, okay, how do you get a lot of vaccine in arms, to sort of a captive population, so to speak, or a walking population, a better way to say that. And so right across the street from our main hospital is Rice University. So we started thinking, I picked up the phone, called their president, and said, hey, would y'all like us to vaccinate some of your folks? At this point, you can't worry about 1A, 1B. You just got to get those vaccines out. And he says, well, as a matter of fact, the county's thinking the same way. They're sending some vaccines directly to us. So they did that. And I said, well, we got 1,000 to do quickly. Can you send me about 300 students or faculty over, and then we'll work with the local neighborhood. So we did that, and we also ended up working with a synagogue that had some physicians and nurses right there that could manage this, and had a very walking community of a pretty Orthodox synagogue. And so that they took a couple 150, 300 doses, and in 3 hours we got them into people's arms. But it was literally, we went into one of our buildings, took a look, and said, okay, those tables there, those will work. This was outside of one of our food courts. And I mean, literally started sitting down. My team, kind of started doing the paper side of things because there was no time to set up our usual computers and stations and everything else that we would use.
Right.
And people started flowing in. I sat down, started giving vaccines. We put a call out, and the physicians kind of came out in droves. And in 2.5 to 3 hours at that site, we vaccinated, over 700 people. So that was very rewarding. And I will say, we took a pause on Monday, Tuesday without vaccinating. On Wednesday, we got to half speed. On Thursday, even at our campus with no water, we were able to stage up our vaccinations. They did 1,500 that day. So at the end of the day, we did over 12,000 first doses alone, and about that many second doses from Wednesday through yesterday, which was Monday the subsequent week, which is kind of our normal cadence is Tuesday to Monday with our supply, which wasn't far off what we should have done. So we've been catching up. Actually, to date, as we speak today, we've done about 245,000 vaccines all told. So we haven't lost steam. We're continuing to push forward. But not everybody could say that in Houston. So we definitely lost, as a community, lost a few days for sure of getting people vaccinated.
And how long do you think it takes for the Houston community at large to get back up onto the pace that they were at?
I think it'll happen this week. So I think, largely by the end of this week, we will have caught up as a community with really the last 2 weeks of vaccine supply. So, on average, it may have taken our community, about a week behind. But at the end of that, you just have a kind of bolus of people moving through who are about a week later than they would have been without the storm. So not ideal, but certainly a lot of great work. And
sure.
Thankfully, we were able to help the county. None of those vaccines went to waste. We had a smaller situation in one of the peripheral counties. We took about 500 of their vaccines. It wasn't as rushed, but over the next couple of days, got those into people's arms. Stored vaccine for them. Our county partners are storing vaccine. County hospital district partners are storing for the county. So that'll sort itself out. And overall, thankfully, no vaccines went to waste.
Okay. Marc, in just a 30, I know it's not a lot of time, but 30 seconds a minute here. One of the challenges and one of the things that's obviously come up for Houston Methodist and other systems is the equitable distribution of the vaccine. Again, you guys aren't alone in facing some criticism about how it's being rolled out. What kind of strategies are you putting in place to make sure that you're reaching populations that have been disproportionately impacted by the COVID-19 pandemic, but aren't getting the high level of vaccinations? Yeah,
it's a great question, and I could speak for half an hour on that because it's a major focus of ours. I actually took one of my senior executives. She runs community benefits for us. It's senior vice president level, and she has a VP reporting her for community benefits, our VP of diversity, equity, inclusion. I basically took that individual and said, okay, in every conversation we have about vaccine logistics, you are the eyes and ears and carrying out of making sure we're thinking about every possible strategy around diversity, equity, inclusion, and really targeting. So it's been a very multifaceted approach. We have we're one of the original 3 hubs in Harris County, the only hospital system hub. When the state of Texas decided to create a hub strategy, and then over the subsequent weeks added to that, but remain that. As I said, we've vaccinated, total doses of about 240 some thousand as we speak. And, we'll probably be at 275 by the end of this week. And so it's been a big focus. We have an open sign up as a hub. And so part of that is strategically focusing on priority zip codes. So we created a list of priority zip codes based on socioeconomic status, where people are against the federal poverty line, diversity statistics, COVID statistics in terms of how hard hit a community was. We worked with the UT School of Public Health, who's been wonderful in doing that. And then to reach that community, it's many strategies, from working with a couple of congressional leaders, putting together some clinics in those sites, working with many community organizations. Churches have been a real great ally of ours in terms of identifying individuals in those communities, and on and on and on. It is a challenge. It continues to be a challenge with Pfizer. We pretty much are, other than helping the county with some Moderna, we're pretty much exclusively Pfizer. Maybe the guidance is changing now, but still the guidance is -70. And when you're trying to vaccinate, and we're doing kind of on average about 30,000 vaccines between first and second doses a week right now. Some weeks peak up. Our peak week was 56 when we had a bolus week. This next week is the third week since then, so we'll have another bolus week. Some of those strategies have to be very local, very small, almost person by person, very time and labor intensive, and that's really an enemy to speed and to high volume vaccination. So those are definite challenges. I think if J&J is approved soon and can come out, I think that's going to be a big ally for ours, because to get that into pharmacies, to get that into physician offices, to be able to go more readily in a lot of distributed community sites will be a positive. Obviously, there's some challenges with that, given that J&J, at least on a preventing illness perspective, seems to have a little bit lower efficacy. And I think it's incumbent on all of us to remind everyone in the community that a vaccine is better than no vaccine. And with J&J, it appears to have pretty similar efficacy around what really matters, which is death and hospitalization. And if it has that similar efficacy to the others, we shouldn't worry. We should just get a vaccine into whomever we can get a vaccine into. We can always sort out some, kind of evening out, essentially antibody levels in a few months when we study sort of some combination things. But right now, any protection is better than no protection, especially since they all seem to be equivalent for death and hospitalization.
Right. Yeah. Let's hope that message starts to resonate more and more, that any protection is better than no protection at all. Marc, again, we appreciate your time. We know you're extremely busy, but it was really good talking to you. We appreciate the time, and please stay safe.
Thank you. It's my pleasure.
And I'm Matthew Weinstock with Modern Healthcare. Be sure to come back next Monday for another edition of The Checkup.